My name is Matthias Schwannauer. I'm a clinical psychologist. I'm based at the University of Edinburgh, and I also have a small clinical role within the NHS Lothian CAMHS service. So that's the Child and Adolescent Mental Health Service, where I still practice. In the university, I lead a research group called Contextual Mental Health, where we are mainly interested in how societal context and historical context affects particularly young people's mental health and well-being, but we also did some work around adults. That has two strands. One is developing and trialing, so basically testing psychological interventions for those with mental health difficulties. And the other one is to think of digital interventions as a way of providing more preventative support, so basically support to young people before they develop difficulties. Yeah, so we've got a few studies going on, actually, and I maybe concentrate on three. So one is a larger study where at the moment we're engaged with 12 secondary schools in the region to get a good understanding of what drives young people's resilience to emotional mental health difficulties. And we're actively working with schools, so we're offering schools workshops. And on the back of that, we also engage young people to collect some data for us, and then we follow them up 1 year and 2 years after that. And as part of the data collection, we're using a digital tool called experience sampling, because we're not just interested how young people respond to questionnaires, but we're keen to learn what they're struggling with and what they're coping with on a day-to-day basis. So we use an app. Everything has an app. We use an app that allows people to tell us how they're feeling on a moment-by-moment basis over a series of days. And I guess that's the innovative part. But then we engage very actively with them. So as I said, we then go back to the school, offer a workshop, and actually feed back to those classes who engaged with us what we're actually finding and what we're making of it, because we hope that will inform how people then continue to engage with us and the follow-ups. Another large project, which we're doing with 5 European partners at the moment, is an implementation trial. So the idea of an implementation trial is that you develop an intervention in a more traditional research setting, but within an implementation study, you basically want to encourage clinical services and clinicians in day-to-day practice to implement what we found to be effective within a research study. Because often we have this problem that we develop great things in research, but then they get stuck and nobody ever uses it. And we write a couple of nice papers that nobody reads, but actually, how do we get the stuff into practice? So this implementation study is aimed at getting clinicians to use experience sampling and client feedback and actually sharing the data that we collect with clients within a clinical service in order to improve how clients engage with their own data, how they engage with services, and hopefully engage with their own treatment. So that's quite a large study where we're interested in what the blocks and the helpers are to get clinicians to use the tools that we find useful in research in clinical practice. So that study is called Immerse, and it still has a bit to go, kind of thing. And then the third study, which is really that I want to talk about, which is really interesting, where we're taking our work with schools to the next step. So again, this is an EU-funded study where we are developing a game-based intervention, because young people told us that that's the medium they would find really helpful to get some more serious stuff happening. So we're developing a serious game around mental health issues, staying well, looking after yourself and your emotional health, and building young people's resilience. So at the moment, that study is in the development phase. So we're actively working with young people to develop the game platform, and we're translating what we learned about our psychological interventions into that different format, which is a huge learning curve for most of us, because I'm not a gamer, so I don't really understand how games work, and I need to learn lots from young people for that. And then the next phase of that project is to trial what we're developing in an initial sort of pilot and feasibility trial to see whether it actually makes any difference and whether it's fun for young people to engage with. Things are moving on a little bit, though. I think one of the problem was that the world of trials and of kind of clinical trials and researchers developing and evaluating treatments was too far removed from clinical services. And I think we often saw clinical services and our client participants as sort of passive recipients of what we were doing here. So I actually think recently with much more public and patient involvement, actually getting clinical experts involved far earlier in the research journey, there's a real nice reciprocal effect here for both sides. So we can both inform clinical practice to be more risk aware, to use adverse event monitoring, to actually measure what they're doing, to be explicit where they're going off the reservation in terms of evidence-based practice, often necessarily because there isn't an evidence base for the particular population they're serving. And at the same time, educating researchers to be a bit more aware of what clinical reality looks like. And I think implementation studies and QI to an extent straddle that gap a bit. So I think if you can do research in a way that's closer to practice, we probably get closer to implementation rather than doing something that has so many criteria attached to it that people read it and say, that sounds great, but there's no way my service will ever be able to do that because we don't have these kind of people, we don't have access to that kind of training, we can't afford the measures you're using, and actually only a third of our clients fit your description. That's not terribly useful kind of thing. So I do think we need to be a bit more oriented towards what practice actually looks like rather than what we imagine practice to look like in a sort of RCT utopian kind of view. And I think, as I say, both sides need to change. I think clinical services need to become more aware of what they actually need to focus on and also, consider risks and feasibility and so forth. And researchers need to get a bit more clean in terms of getting more realistic in terms of how they're designing their trials so they can be implemented rather than isolating an effect like you would do in a lab. How far away are we to really close that gap? I think, we shouldn't really gallop into it either, because I do think we need to be aware that some of our interventions can and have caused harm. We do need to be careful. And we also need to be more forgiving in terms of clinical services who are often in a situation where they have to serve populations for whom there is an evidence base rather than just closing down a service. It's often necessity rather than ignorance that kind of drives a more creative application. I think we've seen quite a bit of development within psychological interventions as well to go away from very strict manuals to more kind of value and concept-driven way of intervening, which actually allows clinicians to flex and yield a bit to what they need to apply, but still stay within a framework that has an evidence base. So the evidence base may start to look a bit looser, less well-defined, but may actually be a lot more applicable. And so I think there needs to be give on both sides. I tend to be quite an optimistic person, and actually looking back, I think we see quite a lot of really positive developments in the last 5 years. I do think that technology can help us with that as well. So I'm both a skeptic, but also I see the potential of actually using what people engage with in a positive and constructive way kind of thing, without, whilst trying to shield the harm kind of thing. But yeah, I wouldn't put a time frame to it, but I think we can close that gap. I do see potential there.